My name is Rafael Sebastian and I'm going to present the work Arrhythmic3D, a fast automata-based tool to simulate and assess arrhythmia risk in 3D ventricular models in collaboration with Centro Médico Tecnoc in Barcelona. As you know, myocardial infarction is produced by a total or partial block in a coronary artery. That induces some damage in the tissue where we can find the area where no oxygen has been received, which is the scar tissue or the core of the scar tissue, where there is no electrical propagation or contraction of the myocardial cells. And then there is a border zone that it's located between the healthy myocardium and the scar tissue, which is the border zone, and it suffers from some structural remodeling and electrical and at mechanical level. This area, this border zone, it's the perfect substrate to start and trigger ventricular tachycardias. As you can see here in the figure, we have an area of a scar, and that would be the border zone, and these arrows show an electrical circuit that can produce ventricular tachycardia and sustain it. At macroscopic level, these channels, which are called slow conduction channels, are the ones who can basically trigger and then sustain over time the tachycardia. In that particular case, would be a monomorphic VT. Doctors have to decide after a myocardial infarction, like the one we are watching here, if the patient is going to develop VT. And in case of developing, they have to perform, to provide or prescribe drugs or perform a radiofrequency ablation. Radiofrequency ablation permits to ablate the entrance and the exit of these circuits to stop them, and then stopping in that way the tachycardia. But there might be some complications, some cases in which patients are not inducible in the EP lab or that suffer from the intervention eventually. So in order to help doctors, there is the option also to develop computational models of the heart that can predict the outcome of a radiofrequency ablation, optimize radiofrequency ablation, or even to decide if a patient that has suffered a myocardial infarction is going to develop a ventricular tachycardia in the future. There have been some retrospective studies that have shown the power of these computational models by biophysical modeling, in which they were able to predict the location of the slow conduction channels and the optimal ablation site, as well as a prospective study in which the data was presented to the doctor beforehand with potential locations of the channels that were sustaining the arrhythmia. However, these models, the biophysical models, are very slow. It requires large computational times. They are very demanding in terms of computational resources and are difficult to translate to the clinics. So the goal of this study is to develop a fast automata-based simulator to assess VT risk in patients with myocardial infarction that incorporate the properties of a physical model, like action potential heterogeneity, action potential duration restitution and memory, for healthy and border zone, conduction velocity restitution, and other effects like electronic effects among cells and the safety factor. All that with very low computational demands. So in order to do that, we have developed a simple automata that has three different states: resting, activated, and refractory. And we have informed that automata performing thousands of simulations, in our case using the Tentacion model 2004, in order for the automata to learn how to react until different input data. And then we have coupled it to a tissue model based on graph propagation, like the one you see here. So we have different cells, which are our automata depicted before. Each of these cells can activate, so go from the resting. So if enough tokens are arrived within a time window, then the cell goes to the activated state, mimicking the amount of current that you need to activate. If not, they are in resting state. In addition, in order for each cell to calculate the action potential duration, instead of using basically the diastolic interval, we use the diastolic interval plus the action potential duration of the previous stimulation, because we want to account on some memory effects of the action potential in every time that it's stimulated. And we also incorporate conduction velocity restitution. To obtain all that information, we obtain in the biophysical model, as you can see here, the action potentials, well, in an isolated cell, and in 3D. We actually looked at the ones in 3D. And once we have all that, we perform an S1, S2 protocol with different parameters, so that we first stabilize the model at a given rate that went from 1000 to 300, and then we perform an S2 stimuli in order to obtain, for different diastolic interval and different resting states, the next action potential duration, and we incorporate that into the automata. With that automata, we perform simulations. First, we try to generate rotor dynamics, so you use exactly the same protocol that was used in the original Tentasser model paper to obtain a rotor with anisotropic endocardial tissue, and we obtain the rotor that you see there. In our case, the colors do not represent potential, but instead time to resting state. So the time since the cell is activated to the time that the cell is going to the resting state. Then we apply the same protocol, but using fiber orientation in the longitudinal axis, in the vertical axis. Then we compare biophysical and automata models. As I said before, well, one is showing the biophysical model shows potential, while the other is time, but they are related somehow. So as you can see there, we have the same pattern of rotation around the center of the model. The frequency of the rotation was 240 milliseconds, which was related to the maximum action, to the shortest action potential duration in this tissue, and matched very well the one of the paper of Tentasser with the original model. Then we check the configuration of the block of the safety factor, and for that one we developed this model that incorporates healthy tissue border zone and a very small conduction channel in the middle of the scar. When we incorporate the safety factor, we get a conduction block at the end of the channel, because there was not enough token, which would be current, to activate all the cells that were here at the exit, while when we don't have the safety factor, it can activate the channel and gets out without any problem. With a wider channel, the safety factor is not reproduced. And to finish, we have this three-dimensional model that incorporates a border zone and a scar segmented from delay enhancement MR, and we perform simulation with the biophysical model and the automata. This is a patient that actually suffered from ventricular tachycardia. So what we did, we apply a S1, S2 protocol in the same location as in the EP lab from here to treat. This is the S1 stimuli, and S2 stimuli produces a conduction block at the entrance of the channel, and then sustains the tachycardia basically through the activation stimuli in biophysical and our model, automata model, and then we perform the same simulation with the automata. Here you only see colors in the border zone. The rest is transparent, so we don't see the core zone or the rest of tissue to watch better the activation. And as you can see, there was a conduction block here at the entrance of the channel rotating. So we could reproduce the same simulation that we have with the biophysical model, with the difference that for us, simulating 1,200 milliseconds took 76 seconds, while with the biophysical models took around 6 hours. But we reproduce it the rest of the parameters. So in conclusion, the cellular automata that we are presented incorporates the cell dynamic behavior thanks to the consideration of the action potential duration and conduction velocity restitution properties. The electrical tissue propagation based on graph and event list makes the propagation independent of the resolution of the mesh. In that particular study, we use the same resolution for both the automata and the biophysical model, which was 2.6 millions, but it was not necessary to perform simulation with the automata. and execution times are much shorter with the automata. So it allows us to perform many more simulations, try more scenarios, and to perform population studies in which the cellular properties can be slightly modified to get more results. So thank you, and I will be delighted to